Good morning, welcome back. Each year, there are more than 200,000 new cases of lung cancer diagnosed in the United States, and it's taking an especially tough toll on women. Joining us this morning from Gunderson Health System to discuss the issue is Dr. Kurt Oettel. Dr. Oettel, we had the statistic there just before the break. It's the leading cause of cancer-related death among females. Do we know why that is?
Well, yeah, it really tracks with, unfortunately, the smoking rates across our country. And the study that you're talking about has really highlighted not just what's happening here in the U.S., but primarily what's happening across the globe as lung cancer starts to exceed breast cancer for women worldwide.
And it's, as you said, affecting more smokers, obviously. Stopping smoking is something that can be done to prevent it, but it affects people who don't smoke as well. What are some of the other ways you can decrease your risk factor for lung cancer?
Well, certainly smoking stands as the biggest cause, but we also know that about 15% of all lung cancer is not smoking related. There is a risk in terms of radon exposure, but unfortunately for many patients who develop cancer, not just lung cancer, we don't have good cause and effect. And one of the problems with lung cancer is that it has such a delayed onset. So relative to exposure to time to develop cancer can be years, sometimes decades.
So I guess the big question is now then, when would somebody go in and get a screening? Like, when would they start to think, hey, maybe I should get this looked at?
Excellent question. We now have data looking at patients who have at least a 30-pack year smoking history. So if you smoked a pack a day, that's a pack year. If you've accumulated 30-pack years and have quit smoking or are currently smoking, you're at risk for lung cancer, and that's the group of patients who we now know are going to benefit by screening with a CT scan.
And obviously, like you said, it takes a while for the onset of lung cancer. Sometimes those who might not smoke might not know they have it for a while, but there are treatment options available as well, correct?
Yes, yes, and this cancer is expanding faster than probably any other cancer in the number of treatment options that we have available, particularly now as we're starting to look at more genetic consequences of cancer.
So talk to your doctor if you have any questions about this, and put out that cigarette for good, may be the best advice this morning.
Please do.
All right, Dr. Oettel, thank you so much for joining us this morning.
Thank you.
And we'll head to break with a look at what's coming up on Good Morning America.